Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Well, good afternoon, everybody, and thank you for joining today's COVID-19 update in North Carolina. As of today, we've had 488,902 total cases, 5,255 new cases reported today, 3,001 people in our hospitals with COVID-19, and sadly, there are 6,291 people who have died. Our thoughts are with those who have lost loved ones, who are fighting this cruel virus, and we know their hearts are heavy during this holiday season. Today, an update to our county alert map reinforces what we already know. COVID-19 is spreading rapidly through our state. As of today, 65 counties are designated as red, which means critical community spread, and 27 counties are labeled orange, which means substantial community spread. This is alarming. 92 of our 100 counties are designated as red or orange. In the last week, we saw a daily case record of 8,444, with the percent of tests positive coming back at more than 10%. This virus continues to spread quickly. Don't get numb to these numbers. They have plateaued a bit over the last few weeks, but they are too high. We have strong safety protocols in place right now, and we have to keep following them. I want to thank local governments and law enforcement who are helping to enforce them. Our communities are safer for it, and your efforts will save lives. I also want to recognize those communities who have seen law enforcement officers shot and killed in the line of duty in these past several weeks. It is senseless and appalling. Violence can never be tolerated, including against law enforcement. And our hearts are with you and those families. Calls to those families are some of the hardest calls that I make, and my prayers are with them and those entire communities. So last week marked the first distribution of the Pfizer vaccine to 53 of our hospitals. This week we'll continue distributing the Pfizer vaccine and begin distributing the Moderna vaccine as well, which is slated to go to 59 hospitals and 97 local health department sites. The federal government tells us how many doses to expect each week, and then the state decides where to send them. We expect about 60,000 doses of Pfizer vaccine this week and 176,000 of the Moderna vaccine. I've witnessed firsthand some of our frontline healthcare workers receiving the first doses of the vaccine. And Dr. Cohen and I were told yesterday at Duke Health that the most common side effect of the vaccine they are seeing is joy. Joy that is a good kind of contagious. I was so glad to see this because our frontline healthcare workers have had a tough time dealing with this painful, lonely, slow death and destruction caused by this virus. Until this vaccine gets enough people immunized, we owe it to those healthcare workers to double down on our prevention efforts like wearing a mask. When you think about their heroic efforts, spending all day on their feet in full protective gear, rushing from one ill COVID patient to the other, it doesn't feel so hard to simply wear a mask at the grocery store or when we are with people we don't live with. Come on, guys. We can do this. Finally, I want to warn about scams that we're seeing related to the vaccine. Don't fall for crooks calling or emailing you and offering a place on a vaccine waiting list. There is no such thing. They're either trying to steal your money, your identity, or both. The state has an action plan to distribute the vaccine effectively, and it does not involve calling you and asking for your personal information or your money. Now I'd like to recognize Dr. Mandy Cohen, our Secretary of Health and Human Services, for an update on where we are in North Carolina. Dr. Cohen.
Good afternoon. Thank you, Governor. We are at a moment in this pandemic of incredible highs and unfortunate painful lows. As the governor mentioned, he and I had the privilege of watching as our frontline healthcare workers who have been caring for COVID patients receive some of the first vaccines in the state. And you could see the relief on their faces when they rolled up their sleeves. It was gratifying to see these heroes who are courageously showing up every day to care for others get cared for themselves. We witnessed the promise of better days ahead. Unfortunately, those days are not yet here. And the lows of this past week have been painful. The number of North Carolinians who have died from this pandemic surpassed 6,000. Record numbers of people in our state are becoming sick enough to need to be in the hospital, and record numbers are in our intensive care units. And as you'll see from the data from our COVID-19 county alert system, all but 8 counties are red or orange. Let's walk through that report right now. As a reminder, the COVID-19 county alert system uses a combination of 3 metrics to categorize counties: case rates per 100,000 people over 14 days, percent of tests that are positive, and a composite hospital impact score. Using these metrics, we categorize counties into 3 colored tiers to describe the level of viral spread and healthcare impact. Red represents critical, orange, substantial, yellow, significant. This slide shows an updated county alert map. We now have 65 counties in the red at critical levels of viral spread. In our last report just 2 weeks ago, 48 counties were in the red. In addition, there are another 27 counties that are now orange with substantial levels of viral spread. That means over 90% of counties in North Carolina are red and orange, with the remaining 8 in yellow still having significant viral spread. If you are in a red or orange county, you should limit going out to essential activities and avoid people that you don't live with. On this slide, you can see how quickly things can escalate. That first map at the top is from just 1 month ago. There was a lot more yellow then. And remember, yellow still means significant viral spread. As you can see from the map on the bottom, our state is now mostly red. As I said at the outset, it's a time of mixed emotions. I remain very worried, and at the same time, I'm full of hope. Hope because we have vaccines that are 95% effective in preventing COVID-19. They were built on years of work to develop vaccines for similar viruses. More than 70,000 people volunteered to be in clinical trials that ultimately showed these vaccines are safe and work. And as of early this morning, more than 24,000 healthcare workers caring for COVID-19 patients have received the first dose of the vaccine. That data is now available on our COVID-19 dashboard. You can see how many people have been vaccinated statewide and by county of residence, as well as demographic information such as age, gender, race, and ethnicity. Supplies of the vaccine are very limited for now. It will take many, many months to vaccinate everyone who wants it. Until then, I don't want to lose any more North Carolinians to this pandemic. Together, we can keep people from getting sick, save lives, and make sure our hospitals can care for people, whether it's for a heart attack or a car accident or for COVID-19. Keep wearing a mask, waiting apart, and washing your hands frequently. As you think about the upcoming Christmas and New Year's holidays, please avoid traveling and gathering. If you absolutely must, get tested ahead of time, wear a mask all the time, keep it small, and keep it outdoors. I'm grateful to the faith leaders here with us today who are doing all they can to protect their communities and finding new ways to join together in prayer and fellowship. Today, my reason is hope. Whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen. As you can see from the county alert map, we are concerned. North Carolina needs to drive down our numbers. To do that, we need to change our holiday plans if we haven't already. The best and safest option is to connect virtually or by phone. But if you gather in person, keep it small and outside if you can. Get a COVID-19 test before you go. Spread out the tables and the chairs. Follow the modified stay-at-home order and be home by 10 p.m. And as always, always wear a mask. It's easy to let our guards down when we're with our family. But no matter how much you trust and love someone, if they don't already live with you, keep wearing a mask. December is a busy time for our churches and other houses of worship, and many of them have found innovative ways to celebrate Christmas and other holidays safely through worshiping remotely this year. Today I want to recognize two faith leaders who are with us. Pastor Joseph Castillo of First United Methodist Church in Roanoke Rapids, and Reverend James White of Christ Our King Community Church in Raleigh. They're here to share some of the steps that their congregations are taking to worship safely over the holidays. I'll recognize Pastor Castillo first and then Reverend White. Pastor Castillo.
I am Joe Castillo, pastor of First United Methodist Church in Roanoke Rapids, and I want to express my gratitude to Governor Cooper and Dr. Cohen, along with a long list of people who have been working diligently in our local and state departments of health and human services. Through these months of pandemic, they have been a tremendous resource to faith leaders across our state. They have given us excellent guidance as we have endeavored to navigate the turbulent and uncertain waters. These waters have brought great disappointment to many of those we serve. While some have been very anxious to go back to the way things were, many others are finding comfort in the measures that we have taken to offer different and new opportunities. Since March, my congregation has only offered virtual worship. On Thursday night, Christmas Eve, we will be worshiping virtually for the first time in our church's history. I want you to think about it. the opportunity for you and your family to remain in your home safely, an opportunity not to put anyone else at risk, and the freedom for you to choose the time that you view that meaningful worship experience. Our service is going to go out at 5 o'clock, but you can watch it later than that. And there's another perk. You can fast forward through the pastor's sermon. So how cool is that? It's a win-win for all of us. This holiday season is going to be a difficult time, and is for many. My phone is ringing more frequently with persons who are struggling. These struggles are real. They need someone to hear them, to offer them hope, to assist them in finding a way forward through resilient supports. The Department of Health and Human Services has established 2 mental health hotlines that are available 24/7 in all 100 counties of our state. The first one is Hope for NC Helpline, and the number for that is 855-587-3463. Let me give that to you again, 855-587-3463. It's a place in which you can turn in your time of crisis. The second one is Hope for Healers. The number is 919-226-2002. Once more, 919-226-2002. It is a place for frontline workers and their families, healthcare professionals, first responders, and other staff who work in healthcare settings and they can assist them and help them in needs unique to their experiences. As a faith leader, I encourage you to take advantage of these resources within your local community. I also encourage faith leaders and my colleagues to be aware of the help that is available as we work together, staying behind the mask, washing our hands, social distancing, and staying home whenever possible. It is a way to provide a safer today and a bright tomorrow. Thank you, Governor. We can do this, and we are.
It was Maya Angelou who said, "You may not control all the events that happen to you, but you can decide not to be reduced by them." This quote is beautiful, and yet it's been a burden. It's been a burden for us not to be reduced by the challenges of these last 10 months. As a church, we've been meeting virtually for 10 months, and we plan to continue that journey knowing that God is not limited to or defined by physical space. No one would have imagined that the celebration of this year's Christmas season would be marked by limitations. None of us can imagine that more than 6,200 people would die at the hands of COVID-19, that there will be over 480,000 total cases here in North Carolina. The personal economic loss has been devastating. And some of us cannot even complete the famous words of Charles Dickens that these are the best of times and the worst of times. No, these have been the most difficult times that many of us have ever experienced collectively. Pastors and rabbis and other faith leaders are often expected to have words of hope. Maybe we're all appropriately lost for words, because what is most needed are actions and perspectives that will lead to life now and in the future. Perhaps we all need to figure out how to create celebrations in the midst of limitation. This is not as impossible as it may sound, because we have neighbors whose lives were devastated by systemic inequities long before COVID-19, only to find that in this time the gap to life as the Creator intended is now even wider. And many of us, we still feel, though, this unknown experience that we've never felt before, limitations. Limitations that have taken away the expected freedom of Christmas. Maybe we all need to remember that sometimes our intentionally forgotten history of indigenous people who experienced forced limitations, slaves who didn't have their limitations changed during this season, and even Jim Crow laws that have created cultural and societal limitations that we still experience today. And yet when we look back, we see that even with those tragic limitations, people were still able to have triumphant celebrations. Well, now, we have limitations that can lead to life later. Maybe the freedom to do what we want to do is not freedom at all. We can discover together the freedom to do what we need to do. Celebration in the midst of limitations, ironically, is the paradoxical story of this season. God puts on flesh, makes an appearance in the limited womb of an unwed virgin, an olive-skinned Middle Eastern child born in a feeding trough, on the run from the oppressive Roman government. Talk about limitations. However, 700 years earlier, Isaiah would remind us, for to us a child is born, to us a son is given, and the government will be on his shoulders, and he will be called Wonderful Counselor, Mighty God, Everlasting Father, and Prince of Peace. No, we cannot control what has happened to us, but we don't have to be reduced by what has happened. And may we together lead others to have a Christmas celebration in the midst of our needed limitations. And I'm thankful for Governor Cooper and his team leading us well.
Thank you so much, Pastor Castillo and Reverend White. We appreciate your efforts to keep people safe, and I hope that many congregations will follow your lead to keep their families safe this year. I know that I have been worshiping virtually, but I do miss my time in the pew, and if we keep working hard, we can get back. For this Christmas in particular, Christmas always has been a time of hope for me, a time to reflect on the year that has passed and all that we have to be grateful for. This year will be no different, despite or maybe even because of the challenges that we're facing. This has been a year like no other, and while it has been difficult and painful, North Carolinians have responded with compassion and resilience and courage at every turn. And at the end of this unprecedented year, let's recommit to keeping ourselves and each other safe so that we can be here next year to celebrate how far we have come. Also with me today, Secretary of Public Safety Eric Cooks and Emergency Management Director Mike Sprayberry. Brian Tipton and David Payne are our sign language interpreters. Behind the scenes, Yasmin Mativier and Ron Vasquez are our Spanish language interpreters. We'll take the first questions from the media, and if you can give your name and your organization, we would appreciate it. Thank you.
Our first question is from Reuben Jones with Spectrum News.
Hi, good afternoon. This is Reuben Jones from Spectrum News in Charlotte. I wanted to see if, based on the recommendations from the CDC panel a couple days ago regarding who should be prioritized for the vaccine, saying people 75 and older, teachers, grocery store staff, et cetera. If that is a recommendation, at this point whether you'll be following or if there's any update in terms of the prioritization. Thank you.
We know that older people certainly need to be prioritized because they have much more of a chance to become seriously ill and to die. And we are now huddling to determine how our priority will change, our priority system will change, and I'm going to ask Dr. Cohen to talk about that process, if she would.
Thanks, Ruben. Yes, as the governor said, and as you mentioned in your question, the federal government advisory committee made some additional recommendations just on Sunday to further refine how we do prioritization going forward. So we are looking at that guidance right now, and we will have changes to our prioritization. So stay tuned as we work through that. And again, as the governor mentioned, we are going to want to look at folks who are at highest risk of dying of this disease, as well as thinking about how we slow the spread of the virus here in North Carolina. Thanks.
Next question, please.
We have a follow-up. Ruben Jones, Spectrum News.
Thank you for that. I also just wanted to see Governor and Secretary Cohen if and when you plan to get a vaccine. Thank you.
So we want to make sure that we follow our priority list. When the time is right, I'm going to roll up my sleeve. I feel very confident that this vaccine is safe and effective. The Independent Advisory Board, which really has no skin into the game, and it's made up of health experts and scientists, have found this vaccine to be safe and effective. So I look forward to taking it, and I will do that when the time is right, and I think Dr. Cohen will do the same thing. Next question, please.
Our next question is from Ann Doss-Helms with WFAE.
Hi, this is Ann Doss-Helms from WFAE. Thanks for having me. Schools across the state are watching these numbers rise and trying to figure out what to do in response when they come back for second semester. Do you anticipate giving any new restrictions or updated guidance for schools?
We know it's important to have, particularly our younger kids, in-person instruction in our schools. However, we have given schools the option to have in-person learning for grades K through 5, but also to have a mixture of remote learning and in-person learning in order to reduce density. At this point, there are not plans to make any changes to those three options because I think those three options cover the waterfront for the schools. We're going to continue to work hard to slow the spread of this virus so that we can get our children educated, and we know certainly that they learn better in school, but we want to take the steps that are necessary to make sure that everybody's protected. Would you want to add to that? Okay. Next question, please.
Our next question is from Steve Wiseman with the News and Observer.
Hi, Governor. This is Steve Wiseman with the News and Observer. Thanks for taking my questions. Yesterday, you issued an executive order to allow mixed drinks to go. If you could have done that sooner this year, why was there a way to do it now?
Well, first, there was an attempt to do this in the state legislature, and the state legislature did not act. We know that the restaurant and bar industry is hurting. We also know that when people go and participate on site with eating and drinking, that there's a greater chance for COVID-19 spread. So we worked very hard to make sure we stayed within the legal boundaries of the law, but we believe that this will provide a safer situation and will also provide an important financial boost for bars and restaurants that are really hurting right now. Next question, please.
We have a follow-up. Steve Wiseman, News and Observer.
Yeah, thanks for answering that question, and thanks for taking my follow-up. With all the spread of the virus around the state and the advice to not travel for Christmas, I'm curious what your plans are for the holiday to celebrate Christmas, and has it impacted that in any way?
I plan to be right here at home in Raleigh with just immediate family is what I plan to do. Next question, please.
Our next question is from Colleen Quigley with WNCN.
Good afternoon. Thank you for taking my question. Mine is for Dr. Cohen. We know that as part of Priority Group 1A, that also includes long-term care residents and staff. When can they expect to get the doses of Moderna that they've been allotted? And part two, how have you determined which of the long-term care facilities in our state will get the vaccines first?
Thanks for that question related to long-term care vaccinations. As you may know, that entire program is being managed by the federal government. They've contracted with CVS and Walgreens to go through the process of vaccinating everyone in our long-term care setting, which is terrific. That vaccination starts next Monday on the 28th. CVS and Walgreens are right now setting up their schedule of which nursing homes and which other long-term care settings they will be going to and when. They'll obviously have to make multiple trips back to that, not just to administer the first and second dose, but to make sure they're capturing all of the different workers that may be on that day or may be coming for a different shift. So I know they're working through that schedule, but unfortunately that's not something that the state has visibility into right now, though we hope to be working with them to understand that better. We understand that it is starting next week. We have allocated some of our Moderna vaccines to that program, so we believe that will start next Monday. Thank you.
Next question, please.
We have a follow-up. Colleen Quigley, WNCN.
Thank you for letting me follow up. So just to clarify, CVS and Walgreens are the ones setting up the nursing homes. Does the state have a role in suggesting or recommending which homes they go to, or long-term care facilities they go to based on clusters or outbreaks, or is it completely up to CVS and Walgreens?
CVS and Walgreens is setting up the schedule on their own. We're certainly advising if they have any questions for us. I think it largely has to do with their staffing and matching the size of the nursing homes with the size of their teams and sort of doing those logistics. But again, I think those are better questions answered by CVS and Walgreens. But we are happy to work with them and answer questions, but they are the ones in charge of doing all of the scheduling. Thanks.
Thanks. Next question, please.
Our next question is from Sam Walker with Outer Banks Today.
Dr. Cohen, North Carolina crossing the 3,000 threshold today with regards to hospitalizations. But one thing that's been on the dashboard and been noted throughout this, that we've not seen 100% reporting by hospitals. Is there any specific reason that's not been taking place? Are there hospitals that are opting out, not reporting? Or are the situation that some are reporting on some days and some are not reporting on others? And do hospitals have the option of not reporting those COVID-19 numbers?
Sam, thanks for that question. As you see, we consistently have 97% of our hospitals reporting. The few hospitals that are not reporting are some of our military hospitals, and that has to do with some of their reporting requirements through the federal government and through DOD. So unfortunately, we do not have as much visibility into those hospitals. But other than the military hospitals, we are seeing across all our hospitals and what is happening. And I think that has our state stand out from other states. The level of visibility, transparency, coordination across our hospitals has certainly put our state in a stronger position to be able to respond to this pandemic. So I'm very pleased of what the hospitals have been doing in order to make sure that we know where patients are, how we can move them around, and make sure we're managing capacity across our state.
Next question, please.
We have a follow-up. Sam Walker, Outer Banks Today.
Governor Cooper, we have a certain group of North Carolinians that are concerned about Thursday night and that curfew that's in place and the fear of drawing the ire of my colleagues here on the call. Dr. Fauci said he had taken care of vaccinating a certain person that'll be in the area in North Carolina on Thursday night and Friday. How does your curfew affect that certain person and his activities Thursday night and Friday morning?
I'll be making an important announcement pretty soon about exempting Santa from the stay-at-home order. So we're going to make sure that he can make all of his rounds. So he will wear a mask, however. He's told me that he would. Thank you. Next question, please.
Next question is from Rusty Jacobs with WUNC.
Good afternoon, Rusty Jacobs, WUNC. Question for Governor Cooper and or Dr. Cohen. Somebody mentioned the hospitalizations topping 3,000. Of all the data you've cited today, which are the strongest numbers or indicators for you in terms of getting out the message that people really need to be careful during the Christmas holiday?
Just the sheer volume of positive cases and our increasing percentage positive shows you that this virus is spreading all around. We look at all of those numbers, and it's also important to look at hospital capacity and ICU capacity. And one of the things we're trying to protect is that capacity so that someone who gets sick either with COVID or a heart attack or a car wreck would able to have a hospital bed and an ICU bed. And I'll take this moment to commend our hospital administrators and our hospital systems who learned a lot over the summer when they surged up and we got ready, and they never were overwhelmed by COVID patients, which is a positive thing. They've learned a lot from there. And so they are managing their patient beds and ratcheting down elective surgeries to make sure that they have room for enough patients and that they've got enough ICU beds. So all of the numbers, I think, are important, and they paint a picture of the fact that this virus is spreading throughout the state. And I'm doubling down, encouraging people to abide by the protocols, because we're going to do whatever's necessary to keep the people of North Carolina safe, and we're going to do what's necessary to prevent overwhelming our hospital system. And we'll do whatever's necessary to do that. Dr. Cohen, would you want to add something?
Hi, Rusty. What I would add is that the reason we put together the county alert map that I went through today is to try to help folks understand one single metric that they can look at to know how are things going in their community. We put together a lot of different numbers, as I said, 3 different impact as well as a hospital composite score. But I encourage folks to look at that map, understand what color their county is, and then heed the recommendations of that alert system. We have so many red counties, as you saw in the presentation here in North Carolina, and 90% of our counties are red or orange. And what we're encouraging folks to do, and what that means, is you really need to be limiting the number of households you're interacting with and really limiting your activities to really only essential activities. Going to the grocery store, picking up medicine, getting health care, going to work, coming right home. I think we have to recognize that the viral spread here in our state is extremely high, and we have to make sure that we're taking care of each other through this holiday time. Thanks.
Next question, please.
Our next question is from Ashley Talley with WRAL.
Hello. Following along those lines of what Dr. Cooper was just talking about, have you all considered doing any restrictions on travel, people going out of the state and coming back in that could be bringing, the virus from other places? Is that something that's ever been on the table?
We have a number of strong protocols in place: a mask mandate, mass gathering limits, capacity limits, which we think right now, if we can get people to abide by those protocols, can help us deal with this situation. But I'll let Dr. Cohen address the specific travel issue.
Hi, Ashley. As you know, the CDC for many weeks now has recommended folks to change travel plans and not to travel and not to gather over this holiday season. That is our top recommendation. We hope folks can change their travel plans and not travel this season. We do recognize that that will still happen. So if you are traveling or gathering, please get tested, wear a mask all the time, stay socially distant, wash your hands. I would encourage folks, if you do get tested, remember a negative test is not a free pass. You still need to be wearing a mask all the time, even if it's with close family members. If you're around anyone who is not part of your household, you need to be wearing a mask. Thank you.
Next question, please.
We have a follow-up. Ashley Talley, WRAL.
So sorry. On another note, I wanted to ask another question following up on what the governor was saying about hospital capacity. We're seeing some of the lowest availability of hospital beds and ICU beds in the capital healthcare region today. I wondered if you believe if that is due to lack of staff or overcrowding of hospitals, or how those two factors play into the availability of the beds.
I know our biggest concern is staff, even more concerned about that than actual physical beds and physical ICU units. Getting the proper staff there, particularly when there's such demand all over this country. But I'll let Dr. Cohen address specifically the question.
Hi, Ashley. The governor's 100% right. We are very much watching the staff capacity. We know that there, and you can see that in our numbers, certain days we have more bed capacity because we have more staff. We are lucky here in North Carolina. It's not a physical space limitation. It is really about our people resources. And it's exactly why our vaccinations have started with our frontline healthcare workers. If we can be vaccinating our frontline healthcare workers, that means they are going to be coming to work, taking care of folks as they have this whole year. But we know that they're a high risk of exposure. We want to make sure that they are safe so they can be there to care for us if we have COVID, a heart attack, a car accident. So we are very much focused on maintaining our people resources, doctors, nurses, and other healthcare workers. Thanks.
Next question, please.
Our next question is from Nikki Hauser with WITN.
Hi, Governor. This is Nikki Hauser with WITN. My question was very similar to the previous one, but we did see a surge after Thanksgiving. Do we expect to see another surge after Christmas? And if we do, what will the state do if hospitals are at or over capacity by then, like we were talking about?
We certainly did see effects from Thanksgiving in our numbers, no question about that. I think Dr. Cohen would tell you that we did better than we thought we would do overall, but we do expect higher numbers from Christmas. We think that a lot of people listened to what we had to say about Thanksgiving, and we hope that a lot of people will listen to what we are saying about Christmas. I think a lot more of our families are being more careful in doing the kinds of things that they need to do. So we hope that we won't see a surge after Christmas, but you know, when people get together, when we know a lot of this is happening in other people's households and with family get-togethers, we expect to see some increase in those numbers. Would you want to illuminate on that? Okay. Next question, please.
Our final question is from Tess Bargerber with WGHP.
Governor Cooper, I talked with several restaurant owners today reacting with the new legislation that allows them to sell to-go cocktails, and some of them were concerned that this was coming at this point in time because further restrictions could be coming in the year. I was wondering if you could speak to those restaurant and bar owners who are worried about the timing of this move.
At this point, we don't have any plans to do that. I've said time and again that all options are on the table to protect the health and safety of North Carolinians, and we will do what we need to do for that. This was put into place because we wanted to make sure that it was a safer way to distribute this and also to provide a financial boost to our restaurants and bars that are hurting right now. I want to thank you all for joining us. I hope your holidays are great. We hope you all have a Merry Christmas, and please, please stay safe. Thank you so much.